And the Canadian government continues to discriminate against First Nations children just as they have always done for the past 147 years. And that needs to stop. What many people are not aware of is that First Nations children on reserve, they are required to be serviced under provincial statutes in child welfare, education, and health. But as the Auditor General and many others have found, Tracy, they underfund these services by a dramatic amount, putting a severe weight on the hopes and dreams of these children, generation after generation. And it didn't matter if the federal government was running a surplus budget into the billions or if it was running a deficit. It still felt the right thing to do was to racially discriminate against children as a fiscal restraint policy. And I am so uplifted that there are unions in this room, from food workers unions to nurses to ETFO to a variety of Unifor and a variety of others who are standing with us, who understand that when we sing that line, "O Canada, we stand on guard for thee," we're not standing on guard for a government that chooses to racially discriminate against a generation of First Nations children. And the third thing you can do is tomorrow I'm actually going back to Ottawa because the Canadian government is on trial for its racial discrimination against First Nations children in child welfare. It is the only example in the Western industrialized world where a national government has been on trial for its contemporary treatment against First Nations children before a body that can make an enforceable order. We're near the end of that hearing, and I feel very confident that the children will win. But we'll need your support, the support of every single one of you, to ensure that when that ruling comes out, that the Canadian government honors that ruling and doesn't walk away from it or shelve it for another generation to absorb.
By showing repeatedly that it will be good for children, it will be good for women, mothers, and it will be good for government finances because they will pocket more money than they will have to disburse. But it has to be repeated all the time because most people believe that a national child care program would be extremely expensive. It's the opposite. They're going to make money out of it. But the most important thing is not money, it's children and mothers. And they are going to tremendously benefit out of them. But it has to be repeated.
Most people think that the healthcare system makes you healthy. Now, it does make you healthy, but only about 25–30%. The things that make you healthy have nothing to do with the healthcare system. So they're called the social determinants of health. And what Canadian doctors are discovering and trying to champion is to understand the concept that if we want a healthier society, we're not going to get it by investing more billions of dollars in the healthcare system. We already spend $220 billion a year on healthcare, and when you take a look at our results in comparison to other countries, we're not doing all that well. So never ever has there been an opportunity for a province to show leadership in this regard. So let's say you have a dream, and that dream is that you wake up tomorrow, and in some province in this country, the premier would happen to be a physician. And maybe the Minister of Health would happen to be a physician. And maybe the Minister of Education and Higher Education would also be a physician. And maybe that person used to be a former Minister of Health. And then finally, what if your Minister of State, to which all the deputy ministers report, was also a physician? Well, that reality is we're talking about Quebec. So never in the history of Canada have four of the most powerful politicians in one province been literally in charge of the entire province and most of the budget. So if these four physicians in Quebec are going to go to the evidence and look at the literature and listen to the Pierres of the world, then I can guarantee you in the next 4 years, Quebec could serve as a model as to how the rest of the country can actually work together and create a healthier population. Because investing another $200 billion in healthcare is not going to increase the health of Canadian members. What we have to understand is that there's a tsunami of disease coming down the pipeline. The rate of diabetes, especially in some communities at great risk, like our Aboriginal communities, is enormous. We're never going to be able to open up enough dialysis units. And to show you how big an impact the healthcare system has, take a look at Alberta. The moment they created Alberta Health Services, They created an organization that employed over 100,000 people. It's the largest corporation in Alberta, if not in the country. So, yes, we're fortunate to have health care the way we have it, but we're very unfortunate that it's consuming $220 billion a year that could be far better spent in improving the health of Canadians. Virchow, a very famous physician, said, politics is medicine on a larger scale. So if we really want to improve the health of Canadians, we really shouldn't be looking at the healthcare system, but we should be looking at the things that Cindy and Pierre spoke. Early childhood development will always give you the greatest return. Remember this one thing: if a mother is carrying a child and that mother is under stress because she's either unemployed, she can't make ends meet, she's in an abusive relationship, she's a single mom with maybe a few kids living in poor housing, the stress that that mother feels is translated to her fetus, and it becomes incorporated in the DNA, in the chromosomes of that child. And that's passed on to the next generation.